evening. I'm Bonnie Lako Shapiro here in Precinct 191. As many of you know, my day job is working in public health communications for the Pima County Health Department. And I'm honored tonight to introduce Dr. Theresa Cullen, our current Health Department Director. Dr. Cullen is a family physician who retired from the U.S. Public Health Service as Rear Admiral in 2012 after leading multiple software development and deployment initiatives within the Indian Health Services. Between 2012 and 2015, Dr. Cullen worked as the Chief Medical Information Officer for the Veterans Health Administration. She developed a new model for field and community involvement in health information technology and worked to expand multiple domains, including data sharing, standards and terminology, and informatics patient safety. Dr. Cullen started here with the Pima County Health Department last summer, officially June 1st, although I can tell you for sure she'd been around for a few weeks ahead of time getting up to speed. It's been amazing to work with her these last 10 months. She came in ready to roll in an incredibly tough situation. Dr. Cullen, I'll hand it over to you.
As you know, our case number continues to decrease. We've been doing really well lately, and we are grateful that we seem to be decreasing our numbers. As you know, the state itself has had over 800,000 cases, over 16,000 deaths. In Pima County itself, we've had over 110,000, about 111,000 cases, over 2,300 deaths. That's about one death for every 450 people in the county, which is a disturbing and sobering number, I think, for all of us that have been involved in the pandemic itself. At this point, our case numbers continue to decrease. We're less than 100 per 100,000. Our dashboard, if you're familiar with it, went from red to yellow for the first time in 10 to 12 weeks. Our COVID-like illness numbers continued to decrease. Our positivity rate continues to decrease. We are now about 7%. It depends on what numbers you look at. And I would warn you that numbers are really fluid, and there are many other dashboards out there, because I'm consistently told, well, your number doesn't sound like this dashboard. So we know that, we acknowledge that. We actually defer to the state many times just to make sure that we have some consistency for the consumers that are looking at both state dashboards as well as county-based dashboards. In addition, when we look at the hospitalizations, our hospital numbers continue to decrease. We have ICU bed capacity. We are cognizant that we've had intermittently a little uptick in our hospitalization numbers. We're not totally sure what's causing that, but we keep a very close eye on it. We work closely with the hospitals as well as the healthcare systems, both in the county and throughout the state. We sit in with the chief medical officers at the state level every week for the past 9 months to get a sense of what's going on in the other parts of the state. As far as public health capacity, as you know, if you recall, last year, we really struggled intermittently and initially to do adequate case investigation and contact tracing. We stood up a contract that continues to today with a group called Maximus. They are able to do contact tracing on all of our cases that answer the phone. People still need to answer the phone. We are able to meet the guidance, which is in an EPI cascade, that you case investigate within 24 hours and then do contact tracing within another 24 hours. Because of our really large and really robust infrastructure, we meet those guidance right now. Obviously, we have times when people don't answer the phone for multiple reasons, but our numbers are over 65%, very high given what we did before. As part of our case investigation and contact tracing, we work with care coordination. Partners in Health has actually been in the county with us. They're an NGO out of Boston. They have 3 people embedded with our work here. That is through a large philanthropic donation that Partners in Health, in fact, got itself. And so for us, that is a voluntary contribution to the county. As we look forward to what we want to gain from COVID, there really are some specific things. And this is one of them, is that at the end of this, we believe we will have touched the vast majority of people's lives within the county. Our case management and our care wraparound services have enabled us to ensure that we can provide not only just COVID guidance, but other guidance to and resources to people that are in the county that we have had contact with. I want to talk a little bit about the variants. We are seeing the UK 117 variants in the county. We've had a single-digit number of cases. We are tracking that. We do that in conjunction with the state lab as well as TGen in NAU. We are aware that the university has seen some of those cases and actually had multiple discussions today with the university. We are not seeing any clustering of any of the variants. Our goal is to test approximately 5% of our positive PCRs with genomic sequencing. We are doing that at the behest of the CDC, who is paying for that. So let me now talk briefly about vaccination. You may be aware that you can find all this on the AZDHS data dashboard if you just search for that, and you can look for vaccinations. Today, the data dashboard changed. So if you look this morning, you may have thought, oh, they're close to 500,000. And if you look this afternoon, you'll see about 411. That's because the state made a decision earlier today, unbeknownst to us that they were going to do it, that they pulled the state U of A pod numbers from the county out of that. So suffice it to say, in the county, we've had almost 500,000 vaccinations given. The county itself, coupled with the pharmacies as well as the FQHCs and other people that we have given vaccination to that we call onboarded partners, have given about 411,000 vaccines. About 25 to 28% of the community is vaccinated. 81% of people over 70 have received a vaccination, a really high number. We actually did not believe we would get into the 80s. That's a number from today. So it's quite a success story. And as you know, the county has made a major commitment to an equitable vaccine rollout, including vaccination of the vulnerable. That includes many different kind of vulnerable populations, economically vulnerable, social vulnerability, census tracts, the disabled, people that are homebound, the homeless. And we have really, through the commitment of our administrator as well as our board of supervisors, been able to meet that. We are doing that primarily with a contractor, Premier Medical Group, that has stood up multiple vaccination mobile sites with us. We've had a lot of success. Just over the weekend, we had a mobile site at Sunnyside High School where we vaccinated over 1,100 people and turned away another few hundred cars. So obviously we have a plan to go back there. It's important to us that we really move that needle on our minority populations. We've worked closely with the Black churches. They've been amazing with their handout to us. We've been at two churches under the auspices of the Black community. There's another upcoming vaccination clinic that's being done in conjunction with TMC and Rising Star Baptist. But overall, it's been quite a success story in some ways, as much as COVID can be a success story. We intend to leverage our lessons learned from this, as well as our multiple organizational partners and organizational reach that we've had, to move us to Public Health 3.0. I want to remind people that there will be a time when COVID is no longer the premier thing the public health department focuses on. And at that point, you will probably forget there's a public health department. Our goal is to ensure you don't forget that, because we want to create the healthiest county in the U.S. within a 3, 5, 8, 10-year cycle. We are making a commitment to that. We're making a commitment to that through our recognition through the Board of Health and the Board of Supervisors that racism is a public health epidemic in the county as well as in the U.S., that we are looking to recovery and resiliency as a part of that. We are working with multiple partners that are both within the county as well as outside of the county and outside of the state. We continue to look for national partners, people like the Institute for Healthcare Improvement, as well as Partners in Health and other people that can help move us along to a more successful public health infrastructure. And at that time, when we are successful, you will forget that public health is the driver, because it will be the community that drives it. And we will solely be one of the partners that are there. And with that, I will stop. And
if you know of people who are hesitant to get the vaccine, What's the best approach for encouraging them to do so?
It's a great question. We actually just recently, in the last few days, have kicked off using a CDC model of how to assess hesitancy. I think that there's multiple reasons why people are hesitant. One is, what is the side effect? The side effects are very minimal, and we can actually share that data. We look at the VAERS reporting, which is a vaccine side effect profile that is reported to CDC. Another major complaint we have heard repeatedly is there wasn't enough time spent in testing. We actually remind people that it wasn't that testing was minimized at all. It was that testing and the creation of the supply chain occurred concurrently, and that is where the major decrease in timing occurred. There also have been some concerns around certain communities of color, other communities that have historically had some issues related to vaccine. Much of that we mitigate just through by talking with people. We offer our own ability to do webinars with any group that is out there. I think a lot of this is at what we have seen is that, and I think that 81% number points this out, is as it goes along and people know people that have gotten the vaccine and done well, that hesitation decreases. Just as we know, I use the phrase, everyone knows somebody who knows somebody who knows somebody. I use that for people that have died of COVID. I also think, though, now we can say everybody knows somebody who's gotten the vaccine, and hopefully that the person that has gotten the vaccine will act as an ambassador to encourage people to get the vaccine as we move forward. The area we're most concerned with actually is the youth as we move into the teens and the 20s. And a lot of that hesitation, I don't think is hesitation. It's that they believe that they will remain asymptomatic if they get the disease. So there's not a lot of fear about the disease itself.
What can be done about the governor's efforts to prevent FEMA vaccines from being provided directly to Pima County?
Well, the Board of Supervisors is going to discuss this tomorrow. I have done what I can do. We did have discussions with FEMA. They were actually really positive. I was active duty public health service for 25 years, so I've deployed myself multiple times through FEMA. Sometimes I got in trouble and had to become a state asset because I was a pain as a federal asset. But FEMA did make this offer to us, and the governor made a decision that we wouldn't take it. I think the decision is far above my pay grade right now.
And the last question I have that was submitted early, does the county have adequate vaccine supply and plans underway to increase pop-up sites or increase mobile clinic geographic coverage?
Last week, we got the highest number of vaccines we got into the county. You know, we're all hearing by May 1, anybody who wants a vaccine should be able to get it. That is a dependency on the vaccine supply itself. We are seeing a little J&J. We got a little allotment this week. We have heard that next week we may get more. Just to remind people, what happens is on Wednesday night or Thursday morning, we get told what our allotment is. We have no indication what it is for the upcoming week, and we also have no ability to influence it as far as we know. That we are scavengers in this county, we're scrappy, and so if there's any vaccine left on the table by anybody else, we just say to the state, hey, shove it our way, and we've been successful with that the past few weeks, which is why we got 4,000 extra doses of Moderna this coming week. I would tell you that right now we are delivering between 35 and 40,000 vaccinations a week. We are geared to deliver 70 to 80,000, and that is the number we need to get to accelerate immunization. When we did our initial plan, our goal was 300,000 vaccines by the end of March. We're at 411,000 now. We believe we'll finish out the month with 450. So we're significantly ahead of our metrics. We drive ourselves by giving audacious goals and following the data. However, for us to immunize the entire, not the entire county, but the county 16 and over, And remember, 16 and 17 have to get Pfizer because the other vaccines aren't approved for them. With the understanding that there will be some people that choose not to get the vaccine, we need to be at around 80 to 100,000 vaccines being delivered for us to meet a goal by sometime in June. And we want to meet that goal by June. We're trying to get ahead of any variants. So we have the infrastructure. We don't have the vaccine. The state knows we don't have the vaccine.
Can we unmute Allison Jones so that she could ask her question herself? It's a personal question that I think affects all of us.
So, my mother's a hand maker, and she's had both of her shots. By April 15th, I will have had both of my shots. I'm still told I will not be able to go get her out and bring her to my house for lunch, even after we both have our vaccines and we go to a safe place, my house.
I think these decisions are made from a risk-benefit perspective, and people have been frightened to make the kind of decisions of putting people out in the community that are elders who we know are really still at risk. There is vaccine breakthrough. I just need to remind everybody that we have vaccine breakthrough in this community from both older elders as well as people in their 40s and 50s. So whatever you do, you need to wear a mask. But Allison, I do think you're going to see this loosen up. I just don't think you're going to see it yet. I think that there will be guidance coming from CDC. We have an indication of that. Just like they decreased schools from 6 feet to 3 feet to really accommodate what is realistic, I think that you will see that coming from CDC, but I don't expect that handmakers will do anything until there's somebody at a national level saying, hey, this is what we think you should be able to do. However, having said that, we do know, the hospitals work closely with us. And as the case numbers decreased, we saw the hospitals, each on their own, doing their own thing, but decide to let family members in, either into the ICU or into the emergency room or into the surgery, pre-op or post-op area. So I would just hope that that does change soon.
One last question, Dr. Cullen, from Mary Alice Thoreau and from Dr. Marlene Bluestein. Is the health department doing anything to assist seniors and others who don't have computers? How do they make appointments? How do they get rides to appointments? How's that all working?
Yeah, actually, we've been doing a lot. I would tell you that the one lesson learned that I've had through this pandemic is that I really wish there was a playbook and I wasn't creating everything on my own with my staff, who is totally amazing. But in this case, we have created lots of opportunities. So we have a call line, the 222 line, and don't ask me for the full number, and maybe Bonnie can jump it in there because I always forget it. If you call that line and you have a phone, and you don't even have to have your own phone, you can have somebody else's phone, we will collect a small amount of information. We will call you back. We will schedule you an appointment. If you need transportation, we will get you transportation. You may have heard there was an offer from Uber. Partners in Health brokered that for us. We're still trying to work that. However, right now we're using our own funding to get people to a site, either TMC or TCC. Right now, both of those sites set aside a significant number of slots for us that we are able to slate people in. At the same time, if you need a home vaccine, if you are homebound, there is a site you can either enroll as a homebound person needing a vaccine at home, either through the 222 number, or you can do it through the web itself. We call you then and we work with you to figure out whether you really do need a homebound vaccination. We can do them for you. As you can imagine, the level of effort for them is higher. So if people are really saying, all I really need is transportation, we once again put them in a system, we get them transportation, we get them an appointment appointment. If they are truly homebound, our public health nurses, coupled with a volunteer crew and coupled with Premier Medical Group, which is the people standing up our pods, are just now initiating going to homes. Now, I say just now, it's not totally accurate. Our public health nurses have been out in the community already. We have a couple hundred people that we have to get that for. In addition, Altex, Mercy Care, and Banner Long-Term Care have been amazing partners. And we were actually their pilot site. Altex has a deal that if you're homebound, we coordinate with them and we can get you a vaccine at home. If you're in even just a small assisted living and there's one Altex person, but there's 5 other people, Altex goes in and immunizes all those people for us. As Dr. Charlton Wilson says, now is not the time to figure out the insurance problems of America. It's the time to get people vaccinated. So we've had a lot of luck with that. It does not mean it is perfect. Every day I get multiple complaints, concerns. I couldn't do this for my family member. Can you make it happen? All of them are responded to, sometimes not in a timely enough manner for people, and we understand that frustration. But the system's getting greased and we're doing better.
Thank you very much.
Okay.
Thank you so much, Dr. Cullen, for coming. I know you work very long days, and we're going to let you go and get some rest now. But thank you so much for coming.
Thanks for the opportunity. Thank you for letting us have a voice.